So your young dog has a front leg lameness that just won't go away. Problem may not be the paw or the shoulder. It could be elbow dysplasia. Elbow dysplasia isn't a single disease. It's a collection of developmental orthopedic conditions that result in an abnormal elbow joint and eventually osteoarthritis. It's one of the most common causes of front limb lameness in young dogs. The major components of elbow dysplasia are fragmented medial coronoid process, osteochondrosis dissecans of the medial humeral condyle, united ankylosing process, and elbow incongruity. And many dogs have more than one of these abnormalities present at the same time. What we see clinically is front limb lameness, stiffness after rest, reluctance to exercise, a shortened stride in the front end, reduced performance, and elbows that are held away from the body, and sometimes difficulty getting up. Some dogs show only subtle signs early in life. Well, who gets this disease? Most commonly, it's the large and giant breed dogs. They're usually between 4 and 12 months of age when we start to see clinical signs. Most commonly, we see it in Labrador Retrievers, Golden Retrievers, German Shepherds, and Bernese Mountain Dogs, and the Rottie. We diagnose it from physical exam, but elbow pain, reduced range of motion, and swelling of the joint. We often are doing radiographs to determine which one of these components of elbow dysplasia is causing the problem. A lot of times we need to use advanced imaging like CT scans and also arthroscopy, where we put a small camera in the joint, not only to diagnose it, but also to help treat it. So a normal radiograph doesn't always rule out elbow dysplasia, especially early in the disease process. Treatment depends on the specific lesion and the severity, and may include things like weight management and rehabilitation and pain control, arthroscopy, and surgical correction when it's indicated. The goal is to improve comfort and slow the progression of the osteoarthritis. Early diagnosis really matters with elbow dysplasia because even mild elbow incongruity can create an abnormal joint force and create the severe osteoarthritis later in life. Over time, these forces damage the cartilage and contribute to these lifelong changes. So the earlier the condition is recognized, the better the opportunity to preserve joint function and health. So a young large breed dog with persistent front leg lameness should always have elbow dysplasia high on the differential list. Not every limp is a sprain or a strain, and missing elbow disease early can mean years of preventable osteoarthritis later on. Follow me for more information on juvenile orthopedic disease in dogs.